Hello, welcome back to our channel. I am Bola Kabasu, founder of Interstitial Cystitis India, and today we are going to discuss the difference between cystitis, which is regular cystitis, and interstitial cystitis. This is a question that I get very often, so I thought I'll discuss it in this video because many patients come and ask me that, Madam, I have cystitis. So that is the reason I thought I'll do this video. Before I begin, I want to remind you two things. First, please subscribe to our channel for more informative content on interstitial cystitis and other chronic illnesses. And second is that many people request for Hindi, so I'm leaving the transcript, the Hindi transcript, in the description box. So if you need in Hindi, just check it out. So let's begin. So, what exactly is the difference between cystitis and interstitial cystitis? So, cystitis in general, it refers to an infection of the bladder. Usually, it could be a bacterial infection, it could also cause some kind of inflammation in the bladder. So, it is a broad term that can encompass various types of bladder inflammation. Now, when we specifically talk about interstitial cystitis, it's more complex and chronic condition. So, interstitial cystitis is often abbreviated as IC or BPS, ICBPS, interstitial cystitis bladder pain syndrome. So, it is a specific type of cystitis characterized by persistent bladder pain and discomfort. So, one thing you should remember is that interstitial cystitis usually, but again, not all the time, but usually it accompanies bladder pain, consistent bladder pain. So, while both conditions involve bladder inflammation, the key difference lies in the nature and duration of the symptoms. So, let's break it down further. So, the common symptoms of regular cystitis include frequent urination, urgency, and a burning sensation during urination. These symptoms are often associated with bacterial infections and they are usually acute. Okay. On the other hand, interstitial cystitis symptoms go beyond just infection related issues. So, individuals, those who have IC, they often experience chronic pelvic pain, discomfort, even after urination, and a feeling of pressure in the bladder. So, what happens if you have IC? For you, you will always feel a pressure in the bladder, and if the bladder becomes full, the pain increases and you really need to pee immediately, or else the pain makes you really uncomfortable. Now, let us discuss the causes and triggers. Okay, the causes and triggers differ as well because regular cystitis is frequently caused by bacterial infection and it can often be treated with antibiotics. Whereas interstitial cystitis doesn't have a clear cause. We for cystitis, we know what is the cause. But for IC, usually there is no one cause, there is no definite cause. And it's believed that, interstitial cystitis is a more complex thing. It's a complex interplay of various factors like repeated UTI infection, autoimmune responses, and probably a compromised bladder lining. The bladder lining can get compromised due to various reasons, and autoimmune is one of the reasons, UTI is one of the reasons. So it's important to note that while the names may sound very similar, these conditions are distinct, and a proper diagnosis is crucial for effective management. So, the treatment approaches for regular cystitis and IC are also very different. Cystitis is typically treated with antibiotics to target the underlying infection, while in IC, it may involve a more complex treatment protocol. It will include lifestyle changes, diet, maybe exercise, medication, sometimes more complex procedures like cystoscopy with hydrodistension, bladder installations, and if it goes further, it can even include Botox and other procedures. But we need not get into all those things at the moment. So more or less what we should know is that IC involves little bit more complex treatment protocol than compared to regular cystitis. So the difference between IC and cystitis is essential because this will help you get proper medical guidance. Your doctor will obviously diagnose on the basis of various tests, and usually what happens is that with IC, test results are often, inconclusive. So that is when they say that IC diagnosis is more of an diagnosis of elimination. So that is how the doctor comes to the conclusion that you have IC. So don't hesitate. And if you have cystitis, it's acute condition, so it will go away. But for IC, it may take longer. It's not that you cannot come out of IC. You can definitely heal IC with proper diet, proper medication, and proper, managing your lifestyle and everything. You can definitely come out of IC. So this is what I wanted to discuss. Hope I have been able to clear the difference between IC and cystitis. And I would like to say that when I'm saying all this, I'm saying from a patient perspective. I'm not a doctor, so I'm not giving you any expert advice or any expert guidance. It's just what I have learned through my own research and through my experience, that the difference between cystitis and IC. I'm doing this video because many patients, they come to me and they have cystitis, they don't have IC. So that is why I thought that I would clarify this, that IC and cystitis are different. They are overlapping. Their symptoms are overlapping, treatment is also overlapping, but still they are very distinct diseases. So if you have cystitis, your treatment protocol would be very different. If you have IC, your treatment would be very different. So that was it. Thank you for joining. If you have any question, please feel free to contact me. If you need any one-to-one advice, please email us. So you know our email, I hope, or else I'll leave it in the description box. So hope to see you next in my next video. Thank you very much.